Very good. Well, good morning, everyone, and welcome to the Tuesday, September 22nd, 2020 Montgomery County Council meeting. We're going to begin this morning with two presentations. The first one is a presentation. It's a proclamation recognizing Direct Support Professional Recognition Week by Council Members Albernaz and County Executive Elrich. And with that, Councilmember Albernaz, if you would like to begin, please.
Well, thank you, Mr. Council President. I know all of my colleagues join me in recognizing the incredible support professionals that we have working to support the amazing organization serving our developmental disability community. We have some of the most remarkable organizations nationally right here in Montgomery County who have for decades been partnering with the county to provide remarkable services to some of the members of our community that need the most support. And these direct support professionals have been heroic through the pandemic. They have been risking their own lives and the lives of their families to continue to provide the high-level service that these families and that these residents count on. And it is truly because of their efforts that these organizations are able to operate and support these communities at such an extraordinarily high level. And so I would like to take the time to thank them for their dedication, for their leadership. We know they are an extension of the families that they serve, and we would not be able to have the remarkable organizations that we have without their support. With that, I'll turn it over to the county executive to make some opening comments, and then he and I will jointly read the proclamation together.
So I'm very happy to be here today doing this proclamation. I think, as most of you know, I have a son who has disabilities, and so for how many years is it now? 45 years. I have had a relationship with the disability community and with their providers, and I know the work they do. I know, it's difficult in the best of circumstances, and it requires a lot of dedication and commitment in order to serve people, and it's become more difficult during COVID. And so I, really do appreciate the professionals in this field and the work they do to make sure that our folks who are developmentally disabled get as much of the services that they can possibly get, and even get them during these difficult times. And I've even watched Zoom meetings come to the disability community because, like my son can't go out on his normal day routines. They have a Zoom meeting every day where people get together, and all that stuff is important. And so, I know their work and I appreciate what they're doing, and it's really appropriate that we honor and recognize the professionals for what they do to make life better for some of the folks who face some of the greatest challenges in life. So thank you for doing this, Gabe.
Thank you, Mr. County Executive. That was well said. I see in the audience is Dr. Raymond Crowell, our incredible Director of the Department of Health and Human Services. Dr. Crowell, if you'd like to say a few words, we'd appreciate it.
Thank you, Councilmember Albernaz and County Executive Elrich for taking the time to recognize the developmental community's providers and the direct support providers in Montgomery County. I think County Executive Elrich's comment was spot on, that these are folks who have been putting themselves on the front line and taking their lives in their own hands and risking to continue to serve members of our community who have intellectual disabilities and intellectual challenges and disabilities, but who with help can become productive and contributing members of our society and can take full advantage of all the richness that Montgomery County has to offer. COVID-19 has not made it easy for folks, and yet they have continued to do it. This is not the kind of work that one comes to because they're seeking fame or fortune. It is born of compassion and big hearts, and it takes that kind of dedication. It's the kind of thing that pulls people out of bed to do the work, not just dragging themselves out of bed, but they're pulled and called to that work. And for that, I thank them very much and appreciate the hard work that they are doing for us. So thank you all. And thank you for doing this, Councilmember.
Absolutely. Thank you, Dr. Crowell. And in the audience, I want to recognize them, but we're going to move to the proclamation. I see Odile Brunetto, who is our division chief for the Aging and Disability Division of the Department of Health and Human Services, who serves as an important partner. And I know Rick Callahan, who is also in the audience, and his organizations and the organizations he represents do an absolutely fantastic job every day of serving our disability community. So with that, Mr. County Executive, I will kick us off with the proclamation, and why don't we do the alternate thing, if that works for you. So, whereas Montgomery County recognizes the extraordinary times we live in, and that the providers of services to developmentally disabled residents of the county have been disproportionately impacted by COVID-19, and
whereas Montgomery County has a strong history of partnership with the DD providers with regular communications, so the DD providers work actively with the county to develop resources and tools to expand safe operations in the face of the COVID-19 pandemic. The county has also created a recovery work group for older adults and persons with disabilities to address provider and community issues, with several DD providers participating in this effort and providing timely feedback and concrete recommendations. And
whereas several county providers are also participating in the Developmental Disability Administration's Regional Provider Work Group, and the county will work with DDA to ensure that we will have a coordinated effort. And
whereas Montgomery County has distributed several rounds of personal protective equipment, increased access to testing, and developed a nurse case management team dedicated to providing support to the DD group home provider community during this public health emergency. And
whereas we acknowledge the tremendous leadership of the DD provider agencies and the direct support professionals who have continued to provide care and support to the most vulnerable in our community. These provider organizations have the responsibility of ensuring the safety, quality, and viability of the community-based system of care that supports people with intellectual and developmental disabilities. These professionals have been on the front lines and have been asked to work many overtime hours to keep residents safe.
Now therefore do we, Mark Elrich as County Executive and Sidney Katz as Council President, hereby proclaim September 13th through 19th as Direct Support Professional Recognition Week in Montgomery County, and ask residents to join us in recognizing the extraordinary work that is being done by our developmentally disabled provider community during the COVID-19 health crisis. Signed the 22nd day of September in the year 2020.
Thank you very much, and congratulations to all, and to thank you to all who are doing this so very necessary and important work. The next proclamation that we have is a proclamation recognizing National Adult Education and Family Literacy Week by Councilmember Jawando.
Thank you, Mr. President. For some reason, my video, okay, there we go. I was locked out for a second there. Looked like some others might have been as well. This is a very important proclamation I'm happy to present, and I'm glad we've got my colleagues on the Education and Culture Committee here, as well as all of my colleagues, because I know we all care about this a lot. This is the National Adult Education and Family Literacy Week, and this week, September 20th through the 26th, and obviously, as with many things with COVID and the resulting recession and unemployment, this has further highlighted the need for adult literacy. Not to mention many caregivers and parents and others have become teachers in many ways and are having to help their young people and their kids and students and grandparents and grandchildren and aunts and uncles at home. We're joined today by Kathy Stevens, which it's great to see you, Kathy, the Executive Director of Montgomery County Coalition for Adult English Literacy, to help us mark this special occasion in this week and to highlight the great work that Mikhail does in this very important space. I know all my colleagues are familiar with the work done by Mikhail, but it's worth noting, as I like to say for the millions watching at home, that Mikhail focuses on the over 126,000 Montgomery County residents who are identified as limited English proficient, as well as their broader community in which they live and work. McHale's activities directly support a network of more than 70 adult ESOL and literacy service provider programs and more than 1,500 instructors in program that those and employees that they represent. More than 7,500 adult learners are served annually through the programs funded directly by McHale, and more than 15,000 are served by the broader provider network. So we're reaching many, and I know they have a goal that I'm sure Ms. Stevens will talk about to reach even more. What McHale provides to Montgomery County is immeasurable. The lives that are made better and the opportunities made possible are not easily quantified. So I want to thank you, Ms. Stevens, and your entire team at McHale and the entire network of service providers who are making a difference each and every day. We're in awe of what you do, and we thank you. So with that, I'd like to invite Ms. Stevens to say a few words, and then we will read the proclamation. And if there's any other council members that want to speak, I'm fine with that as well. Go ahead, Ms. Stevens.
Thank you, Councilmember Jawando, and thank you to the entire council for the continued support that we and the network of providers receive. It really is critical to our recovery as a county that we continue to keep adult education and family literacy at the forefront. It shouldn't be just 1 week. Of course, it's every week. And you really underscored the points I was going to make. This is critical for our economic recovery and continued well-being. And now more than ever, of course, having whoever the adults are in our school children's lives be able to be fluent and even proficient in English to help them with school and for their own needs, whether it be telehealth, whether it be applying for unemployment or getting a new job. It is just crucial that people have the skills in English that they need to achieve their own goals. And right now, I just want to say special thank you again to my staff, the network of providers. We are reaching, and it's a stretch reach given what's happened, the 21,000 learners by 2021, but we're continuing to work towards that. Our providers have been amazing in terms of taking classes online. We still have challenges that we need to work together with places like MCPS and the county on in terms of digital literacy and just providing the actual hardware and software, but we are making great progress. So I want to thank all of our network of providers, thank our staff. Again, big thank you to the council and the county executive for all of the continued support. Our providers are doing double duty with English literacy and helping their folks with food, shelter, healthcare needs, all of that they have right now. So we're very appreciative. We're working hard, and we really look forward to all the continued work we can do together. Thank you.
Thank you, Kathy, and thank you for bringing up that often along with literacy help comes a lot of other help, and in a lot of ways you're kind of like mini caseworkers. So thank you for everything that you all do. I'm going to read the proclamation here, and then we will, and I physically have it, so when I can see you safely, I'll give it to you. Okay, I'll make sure we get it to you, but I'm going to read it for now. Whereas the Montgomery County Coalition for Adult English Literacy does critical work supporting adult education and English literacy, serving over 15,000 adult learners each year, and you heard about the reach goal of over 21,000, and we're going to get there together. Whereas the Montgomery County Coalition for Adult English Literacy, McHale, helps residents throughout the county learn English and improve their ability to participate in all aspects of our society. And whereas universal literacy lays the groundwork for any functioning democracy and is essential to a well-informed populace that can fully engage in society and thrive. And whereas families reading together teaches children the value of reading and gives them the skills they need to be successful in school, while helping parents with literacy challenges to learn and grow themselves. And whereas helping families and adults attain higher levels of literacy and education supports a stronger and more resilient community, ensuring that all members of the community have the opportunity to fully participate in all of the resources our county offers. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes the Montgomery County Coalition for Adult English Literacy during National Adult Education and Family Literacy Week. And we've heard that we need it to be not just a week, but we're celebrating it today. Presented on this day, the 22nd of September in the year 2020, signed by myself, William Chawando, and our council president, Sidney Katz, on behalf of the entire council and the county executives. Congratulations, and thank you again for all the work you do. And I think I saw, okay, I don't know if Andrew's talking, but thank you, Kathy.
Thank you. Thank you so much.
Thank you, Mr. President.
Thank you, and congratulations to Kathy as well, and everyone who's doing this important work for our entire community. And with that, I just got a note that I should start my video, so are we having some, there we go.
I was the only one there. I was the only one there for a second.
Well, we couldn't have that. I mean, so I don't know what issues we're having, but welcome to Zoom. Yeah.
I cannot start mine.
Excuse me?
No, I said I cannot start mine. I think the host has stopped my video.
Are you?
We're all coming back here. I think they do that with the proclamation.
Nancy, are you, or Michelle, or whoever, are you able to get Nancy? But there's Nancy. I recognize her. Okay, very good. And with that, Madam Clerk, do we have any? We're going to actually start our general business. Madam Clerk, do we have any announcements, changes to the agenda, or petitions?
Yes, good morning, council members. I'll start with the changes to the agenda. Under general business, under announcements, A, there's a correction. A public hearing on the Community Development Block Grants, Coronavirus Funds, Round 2 funds, and State CDBG-CV funds is scheduled for September 29th, 2020 at 1:30 p.m. On the consent calendar, number 2A, a correction. 2A, introduction, special appropriation to the county government's FY operating budget, early care and education, non-departmental account, COVID-19, $7,687,000 for school-age child care during distance learning, source of funds, federal grant funds. Lead sponsor is the County Council. Public hearing action is scheduled for September 29th, 2020 at 1:30 p.m. New time for the council sitting as the Board of Health at 10:15. Item 3A will be the update on COVID-19 and county public health planning. 3.1, the council sitting as the Board of Health added introduction Board of Health regulation to adopt an executive order 114-20 COVID-19 local order amending and restating order dated August 24th, 2020, and public hearing Board of Health regulation to adopt an executive order 114-20 COVID-19 local order amending and restating order dated August 24th, 2020. Added 3.2 introduction action resolution to approve an executive order 114-20 COVID-19 local order amending and restating order dated August 24th, 2020 as the County Council. Added council sitting as Board of Health continued. 3.1b, action, resolution to adopt an executive order 114-20, amending and restating order dated August 24th, 2020 as a Board of Health regulation. In addition to the general business, under A, announcements, a public hearing on WSSC Water's FY21 spending control limits is scheduled for September 29th, 2020 at 1:30 p.m. Also, the council has received receipt of petitions. Petition from residents of Montgomery County opposing Bill 29-20, taxation, payments in lieu of taxes, WMATA property established. That is all, Council President.
Thank you very much. And I know that Ms. Parsons, I believe, is aware of this, but Vice President Hucker is still having some video issues, so he's being blocked, I guess. He is here. I mean, he can hear us, but we're not able to see him. So if someone can please figure out what is not working there, we'd appreciate it.
I thought it was something I said.
Yeah, well, it probably was. And you're back. There you go. So thanks. The next item that we have is approval of the minutes. They've been distributed and there's a series of them, for May 6th, May 7th, May 11th, May 12th, May 13th, May 14th, May 15th, and May 19th, 2020, and May 7th, 2020 by county meeting. They've been distributed. Unless there's any corrections, they're going to be approved as received. Next, we have our consent calendar, and we need a motion to approve that. Is there a motion to approve our consent calendar?
So moved.
It's been moved by Councilmember Navarro. Is there a second? It's been seconded by Vice President Hucker. And as we begin, I wanted to make a statement about one of the items. I wanted to highlight the item A on consent calendar, the special appropriation to the county government's FY21 operating budget for early care and education, and it's for $7,087,000 for the school-age child care during distance learning source of funds, and it's a federal grant funds. This appropriation actually addresses three critical problems in the county, and I want to thank all of my colleagues, especially Councilmember Navarro, for working on this. But this is the first in the sustainability of the school-age child care sector. And simply said, school-age child care providers that operate within Montgomery County Public Schools are running out of funds to maintain their businesses. And we all know how very important child care is always, but especially now. They experience 6 months of complete revenue loss. And although they are now able to open their doors, it has greatly reduced capacity with increased expenses. And as one provider shared, we will still lose money every day, just not as much. They need the support of a targeted child care recovery measure. School-age child care, like early care and education, is an essential service to support families as they return to work, and it's critical to the county's economic recovery. The second is the ability of the families of school-age children to access full-day child care while Montgomery County Public Schools is meeting virtually. It is extremely troublesome to know that there are children in our community who are navigating virtual learning without supervision or support. These parents do not have the option to work from home or pay for full-day market-rate care that would offer not only an academic support, but also social, emotional care and enrichment opportunities. And this special appropriation will support low-income working families by funding before, during, and after-school child care while Montgomery County Public Schools is meeting virtually during the first semester of school. This subsidy will be available to families who wish to seek licensed care in family child care homes, child care centers, and school-based programs. Third, it removes the barriers that prevent families who nurture and attend to children in foster care from accessing full-day child care subsidies. Foster parents recently shared with council member offices their challenges in assessing full-day school-age child care for their children. These families provide stable homes to children who need them most. It is incumbent upon all of us to provide adequate support as they face the increased challenges presented by COVID-19. And I want to thank the Montgomery County School-Age Child Care Coalition, the Department of Health and Human Services, and all of my council colleagues for their collaboration. I especially want to thank Mary Geis from my office, who has worked tirelessly on this so that we can get ourselves to the place where hopefully we can be in a better place. And with that, Councilmember Navarro, please.
Thank you, Mr. President, and thank you so much for leading this effort. Very pleased to have worked collaboratively with you. There is no doubt that Montgomery County continues to pay very close attention to the issues of early care and education, especially now with the impact of COVID-19. This is a particular component of great importance, and I was pleased to be able to offer a few amendments that I think have strengthened this particular request. We all know that a large component of the children that will benefit from this are low-income children, low-income families. We know that the provider community is quite diverse, so it was important to include language to provide assistance in the application process for families, also for providers who might need some technical assistance preparing themselves to provide this kind of care. I particularly thought that the component of foster care families, that was very important also. So I think this really is, in my opinion, a well-rounded package with what we did earlier in terms of providing assistance to our child care community. And I believe that this will go a long way in helping so many other families. I also wanted to congratulate those who are being confirmed this morning. We have confirmation to the Board of Registration and Building Contractors. We also have confirmation to the Strathmore Hall Foundation Board of Directors. And also I see an introduction of a very important supplemental appropriation to the Department of Health and Human Services to increase somatic and mental health services at Montgomery County Public Schools. So important. We've had so many conversations in different committees, but also on council session regarding the need for increased mental health support. Given this pandemic, we know that this continues to be an issue of great importance because there is just so much anxiety, depression, so many challenges facing our community. And I think that is very important every single time we're able to add resources to strengthen the provision of mental health services and somatic services. So just wanted to point those out as I think critical part of our work today. Thank you.
Thank you. Councilmember Rice.
Well, thank you very much, and I want to congratulate both you and Councilmember Navarro on the great work when it comes to early care and education, but it's not the first time, certainly won't be the last. There's so much work that needs to be done, and so much has already been said. Let me just reiterate the fact that when we're talking about the education opportunity achievement gaps that continue to exist, it starts with early care and education. And the reality is that even in this COVID framework we find ourselves in that presents challenges, it is incredibly important for us to make sure we're doubling down on early care and education, a principle that's found in the Kerwin Commission recommendations. I hope that the General Assembly will overturn the governor's veto because Governor Hogan has continued to turn his back on education, especially when it comes to understanding how important it is for us to really lay the groundwork when it comes to making sure that we can give our kids the best opportunity. And so, when the governor talks about putting people back to work, the reality is that you can't do that if you don't have early care and education. And oh, by the way, high quality early care and education opportunities that give our children a chance to have a level playing field. And so I just really want to thank Councilmember Navarro, Council President Katz, and all of my colleagues who continue to support this incredible initiative that really is just tantamount to us in the education space. If we are ever to get a firm footing, it starts with our babies. It starts with our children. And so we need to make sure that we're doing that. I did also want to talk about the mental health piece. That was, I want to thank the county executive for responding to the county council who brought this issue up and said over and over again that we need to see more nurses as well as mental health professionals in our schools, especially at a time like this when children are struggling, when they're mentally trying to deal with the fact that they can't socially interact like they're used to, but also having trouble navigating into this digital space for learning. It's incredibly important to have those resources there. And so this is incredibly important also to just make sure that folks can continue to have folks to talk to be able to reach out to say, I'm struggling and having a bad day, I'm just frustrated. Those are the kinds of things that help us to avoid these very unfortunate circumstances that many of us know end up in suicides. And both Councilmember Friedson and I, working with Every Mind, we've seen a number of times the great work that individuals in our mental health capacity have when it comes to staving this off. And just lastly, our new appointment, who I hope that we'll be confirming shortly, who is focused on behavioral health, also has that as his priority for our community. And so certainly something in which I think there's a lot more to come. This is a great continuation, but we know we need to ramp up these efforts also. So thank you very much, Mr. President, and thank you for everyone and all of their great work in highlighting very important needs in our community.
Thank you. Councilmember Reamer.
Thank you. Thank you, Mr. Council President. Just wanted to express my appreciation to you and to everyone involved in making this happen. This is meeting a critical part of the continuum of service that we provide for children. And, you know, we do often focus on the earliest ages because often that's where the need is greatest. But at the same time, we need to ensure that families who have kids in second, third, fifth grade have a quality care for them after school. So right now there is no after school, but your measures here will ensure, hopefully, that more of those organizations, companies, nonprofits that provide care for school-age children will make it through this. And then when we are able to return to school, there will be stronger associations for kids to enroll in. And I'm very intrigued by the possibility of having a place for kids during the day to go and do their learning, in ways that is consistent with our public health guidelines. So that'll be something we will monitor closely. And it does raise all kinds of questions. So I'm glad that you have a big piece of this that is tuition for low-income kids. I know I can speak from my own family's experience. Our school, our elementary school, is offering, the company that provides care is offering space for students in that school to enroll during the day and do their work, do their schoolwork. So it's essentially a tuition-based service for public school kids. Needless to say, that is very problematic. It is I understand why it's happening, and I don't disagree with it. But how did we get to the point where now public school can be virtually attended through tuition? That we are in a very tough place. So, trying to ensure that there are scholarship monies available for low-income kids, so that they can also experience that opportunity if that's what their family really needs. I think is very, very helpful. And I just want to thank you for taking the time to figure that out and bring it to us. And let's try to all work together and get schools reopened as fast as possible, so that we can kind of get out of this box that we're in. Thank you very much. Appreciate all the work.
Thank you. And of course, there is a difference in numbers as well. I mean, obviously, when you're dealing with the numbers of in the Montgomery County public school population of the 160, whatever it is, 1,000 people versus the fewer number for the people who would be accessing the in-school child care. That's one of the reasons that there could be a difference. But it is. Obviously, this is, as we say, as I've said many times, this puzzle is a difficult one to fit together. And with that, I see no other speakers, so the motion was made by Councilmember Navarro. It was seconded by Council Vice President Hucker to approve our consent calendar. All those in favor, please raise your hand. And I believe everybody is on screen right now. That carries unanimously. Thank you very much. The next item that we have is the council sitting as the Board of Health. Today is one of those days where we'll sit as the Board of Health. We'll have a public hearing during that time frame. Then we will go back as a council and vote on the executive's proposal as well, the executive order. And then we will come back again as the Board of Health and vote on the Board of Health this year. But the first item that we have is an update on the COVID-19, and I don't see Dr. Gales or Dr. Stoddard on the screen, but are they here? We're a whole 7 minutes early, so I don't know.
No, Mr. President, they have not joined us.
All right. Oh, thank you. Well, we're not going to go on we can stay here for 7 minutes to go on recess. I don't know that that's, as soon as they join us, we will continue this part.
You don't think we could just break until 10:15? That would be okay.
Well, we can, but let's say if someone is contacting Dr. Gales or Dr. Stoddard to see if they're momentarily coming on.
It's hard to know if I'm watching the grass grow right now or.
Well, you can do that too. You can dual task. You can watch the grass grow and this meeting. Is anybody checking with Dr. Stoddard or Dr. Gales if they are momentarily coming on? If not, we will recess for a full 6 minutes.
Yes, I am checking to see their availability, and while we're waiting for them, I can make some updating announcements for the council.
Please. And you should identify yourself, please.
Yes, this is Marlene Michelson, the Executive Director, and we had indicated to the council previously that we would be updating you each month on operations to see whether we are prepared to return to in-person meetings. And no surprise, we will continue through October to be remote, just as we have been. So we will continue to have remote council and committee meetings. However, we do have a big change to announce. Starting October 6th, we will be enabling people who testify at public hearings to do so by video. It will be their choice. They can determine, so now our residents have a range of options, whether it be written, audio, video. They will have a choice. We are going to be piloting this. I know I've shared in the past that some other governments have had some problems when they've tried to do video testimony, and we've spent some time figuring out how we can avoid those problems. So we'll be starting that on October 6th and seeing how it goes. And we continue to look for your input and suggestions on how we improve remote operations, both to serve the council better and the residents of the county better. So hopefully we'll be continuing to move forward on that as well. And
Ms. Michelson, on that issue, when they're on video, they would be calling in, and that their camera would be on. It would be live. Is that what you're saying?
yes, what we've worked out is there's going to be a slight delay between the time they call in via Zoom to participate and the time that it is broadcast. So in case we have any images that we believe would violate typical,
Yes.
legally established rules of what can be shown on the screen, then their video will be stopped. And one of the, the big issues we had to do was work with our legal staff to determine what image would allow us to stop the video. Obviously, we cannot prohibit free speech, but there are certain standards of what is allowed on television. So that's part of the issue, that the complications of working through this issue.
Okay.
And I do not yet have, oh, there we go. We do have Dr. Gales, and I see from the county attorney's office, Sylvia Kinch. So I think we're ready to turn this over to them and begin.
Thank you very much, Dr. Gales. She really was not filibustering until you got here, but it did work out. It did work out. So welcome, and thank you for being with us today.
Good morning. And if you want to filibuster the time, I'm happy to sit and watch and listen. In terms of that, I will say my remarks won't be filibuster today. Don't have a ton of updates, but we'll create space and time for questions and conversations. So if you would like, I can go ahead and get started. Or
please get started. And I know that you're always under a time frame, or many times you're under a time frame. Can you give us an upfront? We also have the executive order we're dealing with.
Yeah, I mean, we do have a lot going on, so I would say
we will. If there's questions, we'll go to the 5-minute rule while for this part of it. But anyhow, please begin.
Sure. Well, we'll hope everyone continues to stay safe. Again, I'll try to be succinct in terms of updates. Since we had our last session Tuesday and then spoke on Friday. So since Friday, a couple of things have happened. Dr. Stoddard and I met with the non-public schools again for another session on Friday. We spent a lot of time talking through the nuts and bolts of an investigation in terms of when cases are turned up positive. And I just want to remind folks is that per the state guidelines is that schools have a responsibility and a requirement to report COVID confirmed cases as well as COVID-like illnesses. And in both situations, guidance is provided and language is provided in terms of recommendations for quarantining and isolating of those individuals. Now, we've probably had a 50-50 split. I think as of this morning, maybe approximately 20 schools where we have had actual cases that are lab confirmed cases, and the remainder of them have been COVID-like illnesses that have reported that have required in those schools that are in session have required some level of quarantining for the students and staff who were contacts of those illnesses concerning. As of this morning, 2 of those schools have met the definition of an outbreak per state guidelines and input. And we continue to investigate those thoroughly. We reminded and sent out, reminders to schools and families that it's important that they comply with the requests for more information. And as through the investigation process, we also reminded folks that it is the expectation if it is requested that you quarantine or isolate, that you would abide by those rules by law. Because that they are public health laws put into place to protect and minimize the spread of transmission to other communities. We have also received a couple of recent complaints about lack of compliance in a number of schools and places where there is low compliance with face coverings and physical distancing. And our staff will continue to look into those to ensure that those practices are adhered to and students and staff are safe. Now, as of this morning, I think our report was 54 cases today in terms of new cases. The test volume continues to go up and down. This morning, the test, I think it was over 300 cases in the state, but only out of 14,000 tests. And so there's variability within that. And as we've talked about before, we continue to look at strategies to break through the testing fatigue, if you will, because we have actually our capacity to offer tests is back to where we were in early August. We're just not simply seeing the volume of folks come in and get tested. Now, that said, we are testing. We tested nearly 600 folks yesterday throughout the county apparatus. So the numbers are increasing. We're just not exactly back where we were in early August. We continue to work with and identify new lab partners to bring online. We have at least 2 in the queue through potential contract process as we're speaking right now. We're continuing to also explore options that would leverage new technology such as the rapid point of care testing that we've talked about before. We have received slightly more clarification from the state, again, just emphasizing that the majority of those kits that the governor mentioned as part of the state multi-state collaboration will be prioritized to nursing home settings. Since we met last, we've also received some further language and guidance from the state around putting together a vaccine dissemination plan that is informed by the federal guidance that was released last week, basically noting that there will be priority groups spread out. There will be 4 categories of groups, and so things will be disseminated over a course of time and a course of phases. And so not everyone would ideally get the vaccine at once. They would be based upon priority categories, based upon pre-existing conditions and predisposing factors, healthcare workers, first-line responders, those things, and then ultimately in the later phase to the general public. So we continue to, we've actually, as part of our partnership with GW, will have some of their staff assisting our immunization team in developing those strategies. Our first step that we're working on is doing a capacity and needs assessment of our local jurisdiction in terms of our ability to disseminate large-scale vaccine programs. We also continue to work with our regional partners in the National Capital Region to discuss a regional dissemination plan to be able to support the local jurisdictions. We did get some updated guidance from the CDC on last week also. I failed to mention this when talking about schools. That provided a little bit more context in terms of school reopenings. We did talk about this in our Friday morning briefing with you all, and that those criteria break things down by risk of transmission affiliated with the community transmission levels as noted by the test positivity as well as cases per 100,000. Additional measures that they have in their metrics include the burden of the disease as proxy by your percent change in cases per 100,000 over a set period of time, the level of hospitalizations, both acute hospitalizations and ICU care, as well as the presence of outbreaks within the particular community. We did also receive our most recent update Friday afternoon after we spoke in terms of contact tracing. And our contact tracing data continues to show that family gatherings and large gatherings, both at the state level and the local level, continue to contribute to or show up in contact tracing investigations. We also have seen a number of cases affiliated with indoor dining and religious services within the Montgomery County community based upon the most recent contact tracing data. That is important to note because, as you know, again, after we met on Friday, the governor did make a decision to increase capacity in restaurants to 75%. Based upon the data that we have, we are not moving forward or not putting forward from a public health perspective the recommendation to do so, to increase that capacity, as well as we continue to not support moving forward with increasing capacity in other venues consistent with the governor's move to phase 3 reopening. I will stop there, but happy to answer any questions that you all may have related to any of those issues. Thank you.
Thank you. Dr. Stoddard, did you have any updates?
I do. I just have a few. So obviously you all will be acting on the executive order today. We are updating the hours of worship guidance on the website corresponding to that with additional guidelines and recommendations, those that aren't, directives or requirements. Obviously, this has been a partnership where we developed these guidelines in concert with the faith community. We met with them last week and talked through actually the number, the divisible number that we are utilizing is one that was actually proposed by one of the houses of worship. So we are literally taking their recommendations and translating them in because we think we can make them workable via offsets that are guidelines or requirements that allow things to be done more safely. So we appreciate you all taking action on that today. We continue to work on restaurants. I have a draft available to consider for the 10 p.m. Alcohol sales limitation, extending that. I will tell you that it will come with some significant enforcement considerations. We had 3 additional citations issued this last weekend for businesses that were visited. And the reports that I've observed and Dr. Gales observed from those visits were that essentially they were operating as if the face covering ordinance did not exist. And so if we have this extended period of time where we do allow alcohol sales, it will come with severe consequences for failure to live up to the expectations that essentially the business would be agreeing to by extending those sales, up to and including revocation of their liquor license or their food service license, depending on the nature of the violations that occur thereafter, if they occur. Hopefully they don't. We continue to work with MCPS. They obviously we meet with them on a regular basis to discuss how we can support their efforts to begin to do some limited in-school activities, particularly for students, special education, special needs, and ESOL students in limited settings. I know that they're working to make those as safe as possible so that they can begin to do some of those things as the fall moves on. Including we are working with them on potential options for staff and employee and student testing, looking at what options are available there to do testing in those settings to allow those to be more safely done. We are continuing to work on our FEMA reimbursements, and I would add that we are adding additional staff to the team that's working on these FEMA reimbursements to hopefully get them done faster. FEMA issued new guidelines at the beginning of September on eligible work that I think have clarified things or made things more challenging to accumulate in terms of information. So I guess it's a double-edged sword where they're beneficial and there's more clarity, but they're not beneficial in the sense that we have to pull together a whole bunch more documentation. And so that work is ongoing. Our Community Recovery Advisory Group meets again this week. So we're going to be obviously looking at how they actually meet today, and so we're going to be looking at testing and broadband internet access as part of that meeting as well. So we continue to work with the Board of Elections preparations. We are making sure the drop boxes are placed correctly. We're working on procedures and identifying public health protective measures for in-person voting as well. That's something we're working directly with Board of Elections and Public Health on this week. And then finally, I do want to touch on the CDC issue. Over the weekend will have seen that CDC did release initially some guidelines on the risk of aerosols and COVID-19. That has been accepted science pretty much across the world for the better part of the last several months. It's something that obviously is why we have face coverings, why we continue to think indoor spaces are much greater risk than outdoor spaces, why ventilation and number of people inside matter a whole lot, even in calculating what can and cannot be done. And so we continue to look at all of the guidance, not just what's offered by CDC, to make sure that we're getting a breadth of where the science is on these various issues. So I will stop there.
Thank you very much. And candidly, I can understand how you had a moment where you didn't remember what meeting you were going to when. I have a feeling you go to a few. So we appreciate that. Councilmember Navarro.
Thank you very much, Dr. Gales and Dr. Stoddard, for all of your incredible work. Just a couple of items. With regards to our Por Nuestra Salud y Bienestar initiative, just a comment to remind my colleagues that we continue to have a challenge with bilingual therapists and mental health professionals. It is something that I'm looking forward to addressing in a work session. I know Councilmember Albornoz, we've spoken about this, and also with Councilmember Rice to put forth a joint committee session to explore alternatives, because this continues to be a persistent gap, and it's one that is obviously affecting our community quite significantly. Just another reminder in terms of communications, obviously, I think our residents continue to be frustrated, and I understand that it's difficult to follow the bouncing ball when it comes to reopening and what is not open, et cetera. So just again, wanting to reemphasize the need for us to make this as simple as possible. But lastly, just really appreciate the efforts, work that you put forth, Dr. Sauter in particular, to bringing together the faith community partners to find ways to perhaps amend some of the come up with some creative ways and some reasonable ways for our faith-based community to be able to celebrate holidays and things of that nature. Also, in closing, I will say that we're seeing what's happening in Europe right now in terms of spikes in cases, and I think it serves as a reminder to us that obviously as we are working diligently, collaboratively, to see what we can do to facilitate reopening, it remains a problem. And we see it. We've seen it in this country. We've seen it right now in Europe, that it is, I think, human nature, of course, that, we all are all trying to deal with such a disrupted reality. But the truth is that, we can also experience these kinds of second waves in a dramatic fashion that would only set us back. So just want to always keep that in mind when we have these conversations about some, reopening efforts, that it's not an exact science, but we're trying to do whatever we can to keep everybody safe. Thank you.
Thank you. Councilmember Reamer.
Thank you. First of all, I just wanted to briefly say that I'm glad to hear that there's some vaccine I knew there was vaccine preparation underway. I assume there was. I think it would be very good for the council to receive, I don't know if we call it a draft plan or just a presentation as to what the county's own strategy would be, where we might follow the state and federal guidelines, or where we might have our own, permutation. Particularly, I wanted to ask about the prioritization for educators, teachers and other personnel. Dr. Gales, where do they stand, as you know it now, from federal and state? Or maybe this goes to Dr. Stoddard. I'll ask you both, and whoever is most responsible.
Sure. So the categorization, I think that is still being worked out. So the state has attempted to create some specifics within that. The federal government really didn't provide that level of specificity, and I'd be happy to share that information offline with you all in terms of where that stands now. The state has taken a first sketch at it, but again, the task of the local jurisdictions now is to be able to provide some feedback to that document, as well as talk about the capacity that we have. The expectation is that the prioritization of the different categories would align from federal, state, and local levels. I would imagine that they would likely be considered in at least some of the earlier phases in terms of essential employees and first-line responders as part of that.
Okay, perhaps we could have at the next or the one after that, in the near term, one of this session, this regular update on the coronavirus, we could have a presentation about the vaccine strategy, so that we, as well as the public, can just see what's coming downstream, and then what questions, we may have to consider here locally. I'll put that to you, Mr. Council President. I think that would be a very worthy topic for our future COVID-19 council.
And I don't want to take away from your time, but I do believe we should not be giving information until we know the information. So we shouldn't be speculating so that people would think that we have something that we don't have. When there's actual information, obviously we need the update.
Well,
and I will give you back 1 minute. So go ahead, please.
We need to begin planning for the vaccine. We're not saying we know when it'll be here. It's just the question of planning for it. The other issue I want to raise. So if I understand it, the 10 p.m. Alcohol allowance, that was a waiver essentially that you created, and then you offered it to a few restaurants, and then you went to observe. Is that what happened?
It hasn't taken place. It hasn't taken, because we were finishing up developing that process, essentially. We met last week. We had to develop the waiver process. We had to develop the rules around the waiver process and the consequences. And so I've seen a draft on Friday. We just haven't finalized that. We recognize that the high holy days were moving forward, so we tried to get this executive order in place with that being ready first. Now that we've taken those actions, we're going back to the restaurant thing and getting that done this week.
And that is a waiver, or is that a regulation?
It's going to be an opt-in program that allows businesses, essentially, it will likely require an additional executive order modification. I'm looking to Sylvia. She may or may not, she's going to nod her head correctly, not correctly, but with her guidance. So it will likely require an additional executive order modification, but it will be an opt-in program where essentially if businesses want to extend their alcohol sales from 10 p.m. to midnight, they'll opt in, they'll sign up to this permitting process. But what that allows us to do when they do that is if they are non-compliant, the first thing we can do is rescind that permission, because essentially the current way that it's written right now, we can issue a citation, which frankly the cost of a $500 citation is substantially less than you would make just by continuing to sell alcohol, even if you weren't following the rules. And so we want to make sure that there's real ability to work with the businesses to have this be an option, but also that if the option is abused by some number of restaurants, many of them will not. They'll do exactly what they're supposed to do, but in limited circumstances, we may have to take that permission away.
Okay. I just want to say I have grave concerns about this program. I think allowing people to mingle at a bar is just about the very last thing we should do right So if it's a glass of wine at dinner, at a table that's distanced, maybe that's one thing. But
yeah, it's tables only. It's tables only. It is not bar service. I think let us provide. I'm happy to provide the guidance before we obviously it'll go before it's an executive order. And if you want to have some comments on it, I think that would be totally appropriate. I share your desire to make sure that this is not a rationale for or reason for an increase in cases.
Yeah, I just think it's very difficult to actually control, and I think we all know that you set up one framework and the actual behavior is typically different. So this is one area where the more you drink, the less you follow rules. It just seems very shaky to me. So I look forward to getting more information about it. Thank you very much.
Thank you. Councilmember Friedson.
Thank you for that. First of all, I have a different feeling about this. I think that you have done a really commendable job of actually listening and understanding and trying to balance the public health challenges that are obvious, but also the interest and desire of businesses and residents who want to follow the rules, who want to do the right thing. I think the vast majority of folks realize the significant public health concerns. I participated in just about every one of the conversations on these with the various stakeholders, and Dr. Stoddard and the health department have, I think really done a commendable job here. So I also look forward to seeing what these rules are. I have full faith that you will find the appropriate balance. I think that the willingness of the businesses themselves to hire a dedicated person who does nothing other than making sure that the enforcement is happening to add to the county's enforcement efforts will actually show greater compliance, not less, and it will allow us to focus our compliance work on the small number of businesses that aren't doing the things the right way, and allowing the vast majority of residents and the vast majority of businesses who are doing everything they can to keep people safe, to follow the rules, to do things the right way. So I just wanted to make sure that I raised that and mention my appreciation and hope that we will see that soon. Look forward to that program moving forward. And I think this is a good example of finding the appropriate balance, which are difficult, and these issues are obviously challenging. Also appreciate the new guidance we're getting today on religious institutions. I obviously would have preferred it to have happened before Rosh Hashanah, but glad that it's happening now. Again, these are high-risk activities that you have shared with us many times. I know that these answers were not easy to find, but figuring out the give and take to actually address the specific issues. We call them congregations for the reason that they are places where people congregate, and that's really important. I did services myself this weekend virtually, and it was bizarre to me to look at a virtual empty sanctuary, but hope that we can figure out a way in this and in other areas to find that appropriate balance to help residents and businesses and nonprofits and faith institutions do things the right way to keep people safe, but do it in a way that they can understand. So appreciate that. I did have a quick question on the mask order. I know this has been a long-standing back and forth question. Appreciate the fact that we're finally moving forward on the American Academy of Pediatrics recommendations for heavy exertion. Might not be using the proper term of art there, but just wanted to get an understanding of the rationale behind it stopping at age 18. Is there specific rationale for it only applying to children but not applying to adults in the same or very similar activities? I'm not sure if that's best for Dr. Gales or Dr. Stoddard. I
think we both may have some comments on this one. So I think first off, any activity where you are indoors without a mask is not an activity that I would participate in, nor would I have my children participate in, just to be so we're extremely clear. I am, however, not, I think Dr. Gales and I are both not willing to contest the American Association of Pediatrics recommended in this case, and I think that's what it came down to. And so We have had requests from fitness centers and others to the same allowances. We continue to believe that it is more safe to just reduce the strenuousness, I guess, of your exercise than take the face covering off inside. Because if you're attempting to do a strenuous activity indoors, we just talked about this with the aerosols. I think you are putting yourself at greater risk, and you are putting those who are around you at greater risk. And I think that it makes it very difficult for us given the AAP recommendation. And as I said, I still don't think we believe it's particularly a great nor safe thing to be doing indoors, particularly. But obviously, I'm not about to argue with the American Association of Pediatrics on this particular issue. So that fails.
So the AAP recommendations actually only apply for outdoors. They don't apply for indoors. And so when we're looking at, what Dr. Stoddard basically said, if we're trying to make allowances for activities to be done indoors, they have to be done safely. And the expectation is in order to do that safely, face coverings are required.
Thank you.
Got it. Can I just ask one follow-up? You focus on the indoors. Are the adults over 18 outdoors, for instance, playing a soccer game where the similar exertion, is that prohibited under this order? Or that was the lack of clarity I think would be helpful for residents. So how I read it, it specifically references 18 and under, but whether it's indoor or outdoor.
So the specific question that we were asked to clarify was related to pediatric and adolescent child soccer in those categories, and we can have a deeper conversation around the adults. But again, the expectation is by the state guidelines is that physical face coverings are required to be worn where there's physical distancing is not possible to be maintained. And so that is our interpretation from the state level as it relates to those above 18. And certainly there are provisions when you look at the state guidance where they say, in certain activities, face coverings need to be worn by spectators on the sidelines. And as it relates to the actual activity, I think dependent upon the risk level of the activity in terms of the closeness and proximity, determines whether or not the face coverings need to be worn.
Thank you. Councilmember Albornoz.
Thank you, Mr. President. I want to begin by, we were all greatly distressed, Dr. Gales, regarding the messages and the harassment that you have received. And I was proud to join all of my colleagues in the county executive pushing back hard against what is absolutely inappropriate and completely out of bounds remarks. It's been well noted across the country that public health officials are being harassed, they're being attacked, they're being threatened for doing their jobs. And that is, of course, completely unacceptable. And we appreciate all of your efforts and the help of all of your colleagues during this difficult time. We know emotions are raw. We know that there's tremendous frustration being felt by so many different people in our community for a variety of reasons. But that kind of behavior and that kind of rhetoric and language is never acceptable, but particularly now. So Dr. Gales, just wanted to begin my comments by recognizing that. And I know all of my colleagues feel the same way. And we all issued that joint statement together, recognizing that. I don't know if it's a lighter note or not, but on a different note, where it sounds like we've continued to make progress on achieving the goal of establishing and sustaining the 30,000 tests per week. If you can just confirm, I believe we are, but that goal is to be achieved by October, and October's right around the corner. It sounds like we're heading in the right direction, but wanted to confirm that.
Sure. So first and foremost, thank you all again. As we talk Friday, thank you for your continued support, your input and expertise in helping guide our response as we continue to move forward. We really are working together across the board in terms of being able to execute and move things forward. And I will say this, there is a space for race to be in this conversation, less about me and less about work, but particularly as we interrogate and look at how race impacts influence of racism on systemic issues and policies that have been put into place historically for years that continue to perpetuate the long-standing health disparities that have existed for decades, but certainly have played out in the space of COVID. As it relates to testing, we do have the capacity. That's the interesting thing now. We have the capacity to offer tests to folks. We're simply not seeing the volume of people come in. And so when we look at the capacity that we have to offer from the county level, that number is pretty close to where we were, again, back in August before we had to reboot. And the level of testing that's available in the community is still fairly high. The challenge now is getting folks through the doors to get tested, and our townspeople are working on it. The respective health initiatives and programs are working on it in terms of coming up with messaging to remind folks that they should get tested and when and where it's appropriate. So the short answer is yes, we do have that capacity to test. The challenge is getting people to come in and actually fill those spots.
I appreciate that. And then I know we continue to work closely, not just obviously with the state, but our neighboring jurisdictions. I know those meetings are continuing to go on. Are we seeing the same numbers and trends in Northern Virginia and the district and other neighboring jurisdictions as we are here in the county, or are the numbers not the same?
So interestingly, overall, we've seen a decrease in testing. And that's just problematic. So not only in the state, the region, as well as across the country. Interestingly, our testing numbers here each day have actually been on the higher end in comparison to other jurisdictions. Not to say that we're as high as we need to be or we'd like to be, but this is a challenge. So, for example, this morning there were approximately 14,000 tests resulted. Yesterday it was 20,000. The day before, I think it was 12,000. So it's been a little bit all over the place, and it is less about capacity now and more about, what are the barriers, issues, obstacles, influencers that are preventing people from coming in the door to get tested. One of the challenges that has been clarified, I think, that contributed to this was when the CDC put out guidelines about a month ago that said only symptomatic folks should get tested. And even though we continue to say that is not our approach here in the county, I do think that influenced providers to some degree in terms of their willingness to test folks, as well as constituents in terms of saying, oh, well, the CDC said this, so I don't need to go in. Now, since then, unfortunately, we have seen that was not necessarily the recommendation of the CDC, but others who influenced that and pushed that forward. And the CDC has come out with clarifying language to actually say, no, we do recommend that all folks get tested regardless of your symptom profile.
I appreciate that. And then obviously with the opening of the schools, there are lessons being learned right now that I think once we are in a position to open up our entire public school system that we may be able to apply. I assume I know we're tracking all of that information, but if at a high level you could talk about maybe some of those lessons learned to date that we may be able to apply or think about and process as we look at opening the rest of our schools. And I'll yield back to you, Mr. President, after Dr. Gales or Dr. Stoddard answers that question. Thank you.
Well, you're right. So we are conducting investigations and cases, but we also, we have, as part of the ongoing conversation with the schools that have opened, we have learned a lot. And in our meeting with our colleagues from MCPS yesterday to talk about potential reopening there, we, engaged in that conversation. They're working to set up some conversations so that we can glean the knowledge from that group and share it with others. I think one of the biggest things that we have learned is, and the biggest lesson is that opening schools and opening business, opening anything is really contingent upon the level of community transmission. And so even in the best situations, we've had some schools, and I applaud them on the level of financial investment that they brought, equipment and tools and things to keep people safe, and the policies they put into place. But even in some of those instances where all of those boxes have been checked, there still have been cases, and there still have been COVID-like illnesses. And again, I think the biggest lesson take home, at least from my perspective, is that it is a reminder that the burden of community transmission, the higher that number is, increases the likelihood that folks walking into your door, whether it's a school, a business, a religious institution, whatever the space, it increases the likelihood that they are positive and they're coming into your space, COVID positive, and that increases the potential risk of transmission. I think that there are some conversations that need to be had in terms of how we leverage testing, whether it's a routine, standardized testing platform that is made available to staff and students, what role that could play in terms of reopening. I know some of the schools do have larger scale testing platforms in place where they are doing routine testing and screening for their staff and students and have picked up cases as a part of that process. So I think those are probably two of the biggest lessons at this point that I can say that I think we would carry over and have with the community as well as with the public schools.
I would also add the recovery mission area for the education mission area is having a meeting on Friday morning where the private schools some of them are hybrid operating, are sharing with other school systems, including Montgomery County Public Schools as well as Montgomery College and University of Shady Grove, on how they can do what they've found to be successful, what they haven't. And so those best practices are being shared between the schools that are trying to operate right now and others as well.
Thank you. Councilmember Glass.
Thank you, Mr. President. Thank you, gentlemen, for this update. And I also want to thank Councilmember Albornoz for reiterating our support and solidarity for the work that you are all doing, and particularly regarding the hateful messages, Dr. Gales, that you have been receiving. We know that racism and homophobia have no place here, and what we are doing is based on the science and based on the metrics. And so, and just reaffirming our support for the important work that you and your team are doing. Dr. Stoddard, in your comments, in your opening comments, you mentioned that as recently as this week, there were 3 restaurants that have violated mask orders. So, for all the correspondence that we receive, that my colleagues and I and all of you receive about opening up and having restaurants open past 10 o'clock, being able to serve alcohol, everyone has to realize that we are in this together and that these health guidelines that we are putting forth are in the best interest of our residents to maintain their health and safety. And I am fully supportive of expanding those guidelines and allowing our small businesses to do more business. But they have to follow the guidelines. And here we are today, talking about expanding services past 10 o'clock for alcoholic consumption. And there are still restaurants that aren't doing simple things like having their staff wear masks. It's dumbfounding, quite frankly. And so we need everybody to work together so that we can expand and open up in a safe way. And so, Dr. Stoddard, how many other tips or calls to 311 or any other types of communication have you or anyone else received about businesses not following very simple health protocols?
So I'll give you some metrics on this, and I'm glad you asked. So before we instituted the 10 p.m. Limitation, we were receiving between 30 and 50 calls a week on restaurants specifically, and about 15 to 20 of those would be focused on the late night restaurants. Since we instituted the 10 p.m., we've seen a precipitous drop in that number, both in terms of the overall violations, also in terms of the specific violations after 10 p.m. We've continued to do our enforcement, trying to go out to 25, 30 restaurants a week. And to be honest with you, we had seen about a 3 or 4 week period where we did not see any violations. We had some warnings issued for some minor things. And, then I think this weekend we had the 3 citations, which are the first I think we've issued in a little while at least. And so that gives you a sense of sort of where we are overall. It is much improved since we made the 10 p.m. change, but I think that, and again, I think that this 10 p.m. change that we're talking about, where this is an opt-in program, I think the reason why we're not just making a blanket go back to midnight with rules and having it be a potential opt-in program is to give it the teeth to rescind it much more easily for those businesses who cannot follow through on the commitments that they're going to make. It's going to be an opt-in program, meaning you don't have to do anything if you don't want to do anything. But if you're going to go beyond 10 p.m., you're going to follow a set of guidelines that include, as Councilmember Friedson said, hiring of a specific person to enforce, and a more specific set of guidelines, including drinks only at tables, not at the bar setting, all those things that we've talked about. And I'll share it with you all so you can see it before it goes farther. But we want to be able to have some real teeth around, like, we cannot have this be what it was before, and that is a significant source of increased non-compliance.
No, I appreciate you elaborating on that and sharing those statistics. And I'll just close by saying, reminding folks who are listening that the best way to call in a violation is to call 311, correct? Very good.
Yes, we also have a portal on our website on the COVID page. We're taking them in through all sources.
Okay, thank you very much. And as we continue changing our protocols, let's stay in touch and see how this is working.
Thank you. Councilmember Rice.
Thank you very much, Mr. President, and thank you, Dr. Gales and Dr. Stoddard. I'm going to jump right in and just talk about our school system. I know I was on a call with the CDC, with the National Association of Counties a few days ago, talking about what we need to do to open up our schools and what kind of guidance we're seeking from CDC. Dr. Gales, you had mentioned about community transmission and the levels. To this point, have you received guidance from either the state or the CDC around what a proper level of community transmission would be in order to safely open schools?
So for the first part, the state, no. The state's guidelines are based upon a test positivity rate and the cases per 100,000, and the cases per 100,000, it's greater than 15, but the levels are set at that. Now, the guidance that the CDC put forward at the end of last week is a little bit more specific. They break it down into 5 different categories, and they have different levels, more specific measures in terms of, your test positivity range. So, for example, to qualify as lowest risk of transmission in a school setting, their test positivity is set at 3%. So if you're below 3%, and then 3 to 5%, 5 to 7, 7 to 10, and greater than 10. The state is less than 5. And then when you look at cases per 100,000, their numbers are actually based upon the cases per 100,000 over a 14-day period, as opposed to just on a daily basis, which the state guidelines are based upon. And within that, again, you fall into different categories. So there's variability. For example, we fall into the 3 to 5% based upon our 7-day moving back and forth average for test positivity, the 3 to 5% test positivity, which is a lower risk transmission. But when you look at our cases per 100,000 over a 14-day period, we actually, I think, are over 120, which puts us in one of the higher risk categories of transmission. So that's the most specific guidance that we have so far in terms of what the proxies for community transmission for real.
And thank you for that. I think that some of our lay people at home kind of got lost with the very first sentence that you said, because it is very confusing. And it is different guidelines and different guidance coming from different folks. And for us to be on the same page, my plea to the CDC was that we need to have guidance that's clear, concise, that everybody says, this is what the science is telling us, this is what we deem as safe, and utilize that as guiding principles, not just here in Montgomery County, but across the country. And so from that perspective, we still haven't seen that yet. However, I do hear that the CDC is working on trying to get some of that guidance. So we'll keep our fingers crossed and hope for that. But I did want to highlight on something that Councilmember Glass said and something that Councilmember Reamer and I have talked about over and over again. If we cannot control community spread, if we can't get folks to do what they need to do, we are not going to open back our schools. So let me just be very clear. By folks refusing to do the things that we know are going to lower community spread and keep the community safe, it then in turn forces us to keep our schools closed. So again, those folks who believe that it's their constitutional or religious right to not wear a mask, or just fundamentally don't believe that they don't believe in the science, or whatever the case may be, are the ones who are keeping us from opening our schools. This is not the County Council of Montgomery that doesn't want to open schools. This is not Dr. Gales or Dr. Stoddard that don't want to open schools. The county executive is not saying, I don't want to open schools. It's those people who continue to choose to be irresponsible and put the safety of Montgomery County residents at risk. They're the ones who are keeping our schools closed. They're the ones who are denying for our children with special needs and differing abilities to be able to get back into the classroom and get that attention they need. They're the ones that are depriving them of that. So let's come together. Let's follow the rules. Let's make sure that we together can make it happen and get our kids back. You know, we all want our kids back in school. All of us who are parents have children that are at home who we know are missing out on the social interactions. Teachers want to make sure that they can do even more for their students than they can in a distance learning model. And that all happens when we all do the right thing in our community. So Dr. Gales, do you see us going in the right direction? Do you see folks that are sliding in terms of their vigilance, in terms of doing the things that they need to when it comes to preventing community transmission?
I think we've definitely reached an area where we are in a holding pattern in terms of how we move forward, because there are energies to, reopen more things because folks say, well, it's safe to do so, and we're holding people back. And so there's that conversation, there's economics, there's politics, and then there is just individual will in terms of, as we talked about, there are less folks coming in to get tested. We see that, family gatherings and large gatherings continue to be affiliated with case transmission, which are instances that we can control as individuals in terms of making sure we don't let our guard down in those settings because they're around, familiar folks. So I think it's a combination of a lot of different factors. And, let's just be perfectly candid. This is a nonpartisan, apolitical comment, but the lack of clarity of guidelines from the federal level and the state level at times creates chaos and confusion, and that feeds into it. So I think we are at an inflection point right now where the next 6 to 8 weeks, particularly with flu season ramping up, will determine where we stand at the beginning of the year in terms of how far we've progressed in terms of being able to move forward and reopening businesses and schools and things like that. And so it's important that we hunker down, we buckle down, and we stick to those principles and guidelines that we put forward, recognizing, again, it's tough. We've been at this for a while, but we simply can't afford to let our guard down because it'll make things last even longer as we move forward into the next year.
Thank you
very much, Mr. President.
Thank you. The next item that we have, we're actually going to be sitting as the Board of Health. We've been sitting as the Board of Health for the last few moments when Dr. Gales and Dr. Stoddard were speaking, but we're sitting as the Board of Health for the introduction of a Board of Health regulation to adopt an Executive Order 114-20 COVID-19 local order amending and restating order dated August 24th, 2020. We are now going to have a public hearing as a Board of Health regulation to adopt an Executive Order 114-20 COVID-19 local order amending and restating order dated August 24th, 2020. Ms. Kennedy, I know, is going to be conducting this public hearing, and it's my understanding we do have speakers for it.
Yes, we do. We have 2 speakers for this public hearing. Each will have 2 minutes apiece to speak. The first will be Eric Heckman. Mr. Heckman, you may unmute and begin your testimony. Mr. Heckman, are you there? I see you there. Can you hear us?
Mr. Heckman, please use *6 to unmute your phone. Thank you.
Yes, I'm here.
Great. You may begin your testimony, sir.
Thank you. Thank you, Dr. Stoddard, for an update on the alcohol curfew. I enjoyed your appearance on WRC TV a couple of weeks ago. That being said, I think Councilmember Friedson, who has been incredibly responsive and helpful during this whole issue, I am one of the owners, along with my son Ronnie, caddies on Cordell. We endorse very strong and strict protocols and severe penalties in an effort to expand the curfew. The reality is that the curfew is 9 o'clock, not 10 o'clock, because customers don't venture out for only an hour. So any kind of expansion would help. Most restaurants are experiencing huge decreases in revenue. This is going to get worse as the weather gets colder and our outside facilities are not as useful. As an example, Caddies employs 4, very large, and professional security personnel. Their total responsibility is no one enters our premises without a temperature scan with a forehead thermometer and the enforcement of mask wearing, social distancing. That, of course, after they check IDs so that underage drinking is not occurring on our premises. We are willing to add and have suggested to the people involved in looking at the expansion to add additional employees, and even if they are county employees or police, we're willing to add even more and at our expense with the opportunity to try to keep our business going. No secret that county revenue and ABS sales, food and tax revenue is declining and will continue to decline as the weather gets colder and outside facilities are no longer available. On that note, I hope the council will look at the District of Columbia yesterday introduced legislation to provide a $6,000 grant to restaurants to upgrade and winterize their outside facilities. The return on investment on this would be obvious in terms of increased revenue to the county by county residents continuing to be able to use restaurants outside where we agree is the safest place for them to be used.
Mr.
So
Heckman,
we encourage the council.
Your time is up, Mr. Heck. Your time is up. Thank you very much.
Okay. Thank you very much.
Our next speaker is Matthew Libber. Mr. Libber, you may unmute and begin your testimony.
Council President Cast, members of the council, thank you for having me here today. Dr. Gallows, Dr. Stoddard, thank you for your work on this and working with us to find resolutions on the sports side of things. And my comments drastically changed after your comments, Dr. Stoddard, and I just want to really at this point get clarification. And I 100% agree with you that indoor sports and masks should continue to be a requirement. And while we have not opened our indoor side, that will be one of our, we will imply or insist on masks inside. I just want to get clarification on outside and follow up to Councilman Friedson's question of why adults are left out of the current order releasing the mask requirement for outdoor soccer or outdoor sports in general. I don't think the risk stops just at 18, and I do have grave concerns for our adult soccer players wearing masks that, a heart attack or something along those lines is a real possibility while wearing a mask while running and playing soccer, and just want to get clarity on why that decision was made and if there is room to have that lifted as well.
Thank you very much. Mr. President, that wraps up our speakers for this public hearing.
Thank you. This closes the public hearing, where the public hearing is now closed. We are going to have an introduction, and that was the public hearing as the Board of Health, which is the same topic, obviously, as the introduction and action, which is a resolution to approve an Executive Order 11420, local order amending and restating order dated August 24th, 2020, as the County Council. The first vote is as the County Council. Is there a motion? Councilmember Albernaz made the motion. Councilmember Rice seconded it. All those in favor, please signify by raising your hand. And that is unanimous. Thank you very much. The next item, we're going back now and sitting as the Board of Health, and that is for the action item of the public hearing we just had. It's a resolution to adopt an Executive Order 11420, amending and restating order dated August 24th, 2020, as a Board of Health regulation. Is there a motion for the Board of Health regulation?
So moved.
Councilmember Alvarez, Councilmember Rice made the motion and seconded. This is a roll call, so Madam Clerk, could you please call the roll? Wait, before you do, Councilmember Reamer wanted to speak. Quickly, please. Go
I
ahead.
just wanted to address the testimony from Mr. Liber. In case it's not clear to those watching, we receive a final version that we essentially affirm from the executive branch, so we cannot amend it here and then have it be in effect. We would have to receive an amended version. So just wanted to lay out that process issue. We're voting now to affirm what we've received, and that's really the only option that we have, either reject or approve. Thank you.
Thank you, and I appreciate the clarification. Madam Clerk, if you would please call the roll.
Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Giwando?
Yes.
Mr. Giwando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Albanese?
Yes.
Mr. Albanese votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes.
Thank you. That carries unanimously. And with that, we are now going to go on recess. We actually will be back at 1:30 for public hearings. And we also, at the end of the public hearings, will have an interview for the county executive's appointee as Chief Administrative Officer, Richard Madalino. But so we are now on recess until 1:30. Thank you all very much, and see you in a couple hours.